Building Strong Patient Relationships, Dentistry's Guide with a Personal Touch. Welcome to another episode of The Educated Associate. I'm Dr. Schick, and today we're going to dive into the art of building strong patient relationships. Dentistry doesn't have to be so intimidating, folks. With a mixture of remembering the patient, humor, and relatable metaphors, as well as some compliments, we can create an environment where our patients feel comfortable and cared for. You know, dentistry sometimes gets a bad rap for being scary or impersonal, but here's the secret. It doesn't have to be that way. By adding a personal touch, we can transform a routine dental visit into an experience that leaves a lasting impression on our patients. If you can find a way to make the experience memorable for your patient, and in a good way, you will also retain that patient and therefore earn more money over time. So it's a true win-win to get to know your patients. One of the keys to building strong patient relationships is making our patients feel special and valued. How do we do that, you might ask? Well, it starts with listening and remembering the little details. When a patient shares something personal during their visit, like a hobby or a favorite vacation spot, I make sure I jot it down in their chart. Now, here's the magic part. Imagine the patient comes back for their next appointment, and as they settle into the dental chair, you ask them about that hobby or vacation. It shows that you genuinely care and have been paying attention. It's like saying, hey, I remember you, and I remember what's important to you. When the patient feels like they are more than a number in your dental chair, they are more likely to listen to your recommendations, which makes your job easier and simultaneously means that you will earn more. Every EHR I have ever worked on has a section that is not actually a part of the clinical record where little notes can be added about the specific patient. This section is not a portion of the clinical record and would not be auditable, so feel free to describe their vacation or the name of their child here. Humor is another incredible tool we can use to break down barriers. Dentistry can be so serious, but injecting some lightheartedness into the experience can make a world of difference. Now, humor is not for every patient, so you must use some professional guidance, but on some anxious patients, cracking a joke can be an excellent icebreaker. Another excellent time to incorporate a joke is at the end of a treatment. For example, on children, I'll often finish a filling and say to the child, oh shoot, I put a blue filling in there and I meant to do the pink one. The parent has already seen the restoration and is aware that it's a white restoration, but the child isn't in on the joke. Sometimes they just laugh. Other times they become worried about the color. Either way, we end up showing them the filling and just put their mind at ease. This is a good way to ensure you end on a positive note and everyone having a good laugh. Another treatment technique that I am fond of is using metaphors to aid in patient education. I love using metaphors to explain dental procedures. Dentistry is just so esoteric, plain and simple. It helps patients relate to what we're doing and alleviates any fear they might have when I talk in metaphors. This works on both adults and children. Below, you will find a list of some metaphors that I use literally every day. When I use the slow seed handpiece for a cavity preparation, I tell them it's going to feel bumpy, like they're driving down a dirt road, and I simultaneously jostle their shoulder so they feel like they're going down a bumpy road. When explaining periodontal disease, I described that the bone is like the concrete foundation under your house, and that you wouldn't want to put up your dream house on a gravel foundation, just like we don't want to fix up all your teeth if the underlying bone and gums are unhealthy. When I evaluate PA radiographs, I tell the patient that big, long, thick roots is a good thing. Think about roots like a stick in the mud. The further you put a stick in the mud, the harder it'd be to pull that stick out. Patients that have root hypersensitivity, and I'm encouraging them to use anti-sensitivity toothpaste like Sensodyne that has potassium nitrate in it, I explain to them that your roots have little nerve endings in them, kind of like uncorked bottles, just looking for a stimulus. The potassium nitrate goes into those uncorked bottles and corks them so that you don't feel things anymore. Another good one I'll do is on root canal treated posterior teeth needing a full coverage. Tell them that I took a solid structure like a big piece of glass and hollowed it out into a wine bottle. Now we need to put something strong on the outside so that it doesn't want to shatter, just like a wine bottle would. By using metaphors, you will not only help the patient to understand what is happening to them, but also show how well you understand the problem by being able to talk about it in various lights. This can really help to sway a patient into getting treatment as they now understand what you want to do. Lastly, I want to emphasize the power of compliments. You'd be amazed at how far a genuine compliment can go in building trust in boosting patients' confidence. Whether it's praising their oral hygiene efforts or complimenting their beautiful smile, acknowledging the positive aspects of their dental care brings the whole person to life. Here are some compliments that I like to incorporate. I love your smile. Tell me about your shoes. Where'd you get them? Oh, your hair looks so nice today. When did you get it done? Just by making the patient feel special with a compliment, you can allow them to let their guard down and make treatment easier for the both of you. I mean, who doesn't enjoy a nice compliment from time to time? Remember, folks, building strong patient relationships is all about creating a welcoming and personalized experience. By incorporating humor or relatable metaphors and complimentation into our interactions, we can make dentistry a much less daunting and much more enjoyable experience for our patients. That's a wrap for today's episode. I hope you found these tips helpful in your journey, can incorporate them into your treatments with patients to help you connect with more of your patients. Join me next time as we explore more exciting topics in dentistry. If you found this information useful, hit the like button and give me a follow. If you'd like more information, you can find me on Instagram at The Educated Associate, on Facebook at The Educated Associate, or much more information on my website at theeducatedassociate.com. And as always, stay drilling, my friends.